Now, we're going to present our own awards on top of the real awards. These are what we call the Patient Safety Humanitarian Awards. When I dreamt of the impossible at Massimo to solve the motion artifact and low perfusion problem with pulse oximetry, you won't know how many people told me it can't be done. You won't believe how many people told me that it's been tried before. And, we did it, we believed in it, and there was an amazing, wonderful friend of mine who was also a gifted engineer, Mohammed Diab, who took the first step to show that it could be done. This is no different for me than when I started Massimo about 25 years ago. When we began this patient safety movement 2 years ago, roughly, some people say less than that, we did not know if we're going to make it, but we knew the challenges had solutions. We knew we were surrounded by people that were gifted, that had wills to do whatever was necessary to get things done. But tonight, we're going to honor 4 people that helped us all, like Mohammed did for Massimo, believe that we can get to zero by 2020. 2 of these people I've had the pleasure of knowing for a long time. I have the pleasure to be able to call them friends. And it's because they are selfless. They're not looking for the limelight. They just do what they do because of their belief that they can make a difference, and they have made a difference. And you'll know who they are from the friendship I had with them. It's Dr. Ramsey, Senator Tom Harkin, and I just can't tell you how sad I am to see Senator Harkin announcing that he's no longer going to be running for Senate again. But these are the people that have made the dream look real. We got to now next year make it even look like it's more than the way it is today. So let me get started, because you need to meet these people, and these are the people that have helped us to get to 1 + 601. So first, I would like to ask a person I met at this meeting last year, who in the middle of one of the breaks came up to me and said, "We want to do something. It's not one of the apps you've come up with here, but we want to do something, and will you help us do it?" And I couldn't say yes fast enough. That's Robin Betts from Intermountain Healthcare System. Robin, please come up.
Last year we came here as guests, me and Dr. Smith, who wasn't able to attend today. We lead patient safety in our organization, Intermountain Healthcare. We have the greater share of the healthcare market in the state of Utah. We wanted to reduce central line associated bloodstream infections because of the terrible ramifications of that. When we set the goal made this commitment, we also committed our entire organization, 22 hospitals, every unit. And we were already below national benchmarks and, the CNOs, and thought, well, maybe we should focus on something else. And I said, no, we need to get to zero. We didn't make zero, but I wanted to make sure our goal was statistically significant. We set an entry target and stretch. We exceeded our stretch goal. Our infection rate during our measurement period went down to 0.71 infections per 1,000 line days. Across our 22 hospital, that interpreted, though, to 63 infections this year. So, that's, if you spread it out evenly, it's a little less than 3 infections at each hospital. We had a little over 14,000 patients with central lines, and we will continue to work to drive it down to zero. I accept this honor on behalf of all of the line staff and physicians that do an incredible job caring and loving for our patients, every day.
We didn't know how you wanted to Skype, so we haven't Skype yet, but if you want to do that, do you want to? Do you want to say it?
Oh, yeah. So I'm going to, he wanted to talk about, Intermountain is doing work in almost all of these areas, the apps that were presented, and so I'm going back and we'll meet with my Vice President of Clinical Operations and CNO to see if we couldn't submit commitments, because we already have measurable goals that we're working on, and really be able to quantify the power of this work, that just because we made a commitment, we made another commitment this year, but what are all the other work that we're doing that we could then bring into this organization to help us all feel the impact of the improvement. So we're just really excited about it.
Thank you so much, Robin. Thank you. Thank you. What an honor. Thank you so much.